Hello. Today we'll be discussing and talking about the axial calcaneus and how to set up our patients for this position. Let's begin. First, we will need our patient preparation. We need to properly be able to identify our patient and state that we will be taking their images today. We first must introduce ourselves and ask our patient for their full name, date of birth, and last menstrual period if needed. Our image size for this image should be a 10 by 12 cassette. Our image receptor orientation should be set to portrait mode, and our image receptor location should be the tabletop. Our SID for this image will be at 40 inches. Our patient positioning for this image, we will end up having our patient placed supine or seated on the table with their leg fully extended. It is all the preference of the patient depending on what they feel is more comfortable. Our part position. We need to center and align the ankle joint to the central ray and to portion of the image receptor being exposed. We also must ask our patient to have their foot dorsiflex so that the plantar surface is near perpendicular to the image receptor. Our central ray location for this image should be to direct the central ray to the base of the third metatarsal to emerge at a level just distal to the lateral malleolus. Our central angulation for this image should be 40 degrees cephalad from long axis of the foot. Our collimation size for this image should be closely to the region of the calcaneus, approximately 1 inch or 1 finger on both sides of the foot. Visual of the appropriate marker location should be anywhere in the collimation field so long as it does not obscure the image or come out within the anatomy of interest. Our kVp for this image should be approximately 65 to 70 kVp. The instructions to the patient for the exposure would be to have our patient hold still and not to move for us while we expose. Any little movement will cause our image to have rotation and will not let us see the anatomy of interest. The anatomy demonstrated within the image should be the entire calcaneus should be visualized from the tuberosity posteriorly as well as to the talacaneal joint anteriorly. The items in profile should be the entire calcaneus, talacaneal joint, as well as the other bones that form the ankle, such as the cuboid bone, the navicular, the talus, as well as all three parts of the cuneiform. Pathologies that best be demonstrated within this image will be pathologies or fractures with medial or lateral displacement. That is all we have for today on how to set up our patient for our axial calcaneus. Thank you.